Hello everyone, welcome to the channel. Today we will learn about barrier methods of contraception. So if we classify various methods of contraception, they are being categorized as temporary and permanent. Permanent include your terminal methods like vasectomy and tubectomy. So temporary method are also known as a non-terminal method or spacing method, and these methods are being further classified into 5 groups: barrier methods, intrauterine devices, hormonal method, post-conceptional methods, and other miscellaneous methods. So in this video we will learn about various barrier methods of contraception. So barrier methods are also known as an occlusive method, and they prevent live sperm from meeting the ovum. These kind of contraception requires a high degree of motivation on the part of user, and they are also known as a conventional contraceptive. Means those contraceptive which require action at the time of sexual intercourse. So barrier methods can be classified as either mechanical or chemical, or they can be used in combination of mechanical and chemical method to increase the effectiveness of contraceptive. So in mechanical method, for males we have a condom, for females we have a condom, diaphragm, cervical cap. In chemical contraceptive, also known as a vaginal contraceptive, we have various kind of creams, jellies and foam tablets. So these are various barrier method which we will see step by step in further slides. Coming to condoms, condoms can be either male condom or female condom. Male condom is an external condom, and it is a thin sheet which is worn over the penis to prevent the sperm from entering the vagina. So it is being worn over the erect penis. Female condom are also known as internal condom. It is a pouch which is worn inside the vagina to prevent sperm from entering. So it is an internal condom, and you can see there are 2 rings. So inner ring is covering your cervix, and your outer ring remains outside the vagina and covers the vulva. So we should remember that although female condoms are available in the market, but they are not included in the Government of India Nation Family Welfare Program. Coming to male condom first, it is a very simple but effective method of contraception if it is being used correctly and consistently. It is the only contraceptive method that provides the dual protection from both the unwanted pregnancies as well as the sexually transmitted infection, including the HIV. And it is one of the methods which ensures the male involvement in the prevention of unwanted birth apart from the vasectomy. So under Nation Family Welfare Program, they are being marketed under the trade name of Nirod. And this word Nirod is derived from a Sanskrit word that means prevention. The failure rate of male condom is important and asked very oftenly in your viva, and it ranges from 2 to 14 per 100 women years. Female condom is also known as a femidome. It is a pouch which is made up of polyurethane which lines the vagina and also the external genitalia. The inner ring is inserted at the apex of the vagina and the outer ring remains outside. So there are 3 types of condom. They can be made up of either of the polyurethane, or the female condom can be made up of nitrile polymer, or they can be made up of latex. Their failure rate is slightly higher as compared from the male condom, and it ranges from 5 to 21 per 100 women years. So if we compare the male condom versus female condom, so we can see from here that the size of the female condom is comparatively higher when compared with the male condom. Male condom is made up of latex, while the female condom can be made up of polyurethane or nitrile polymer. There is only 1 ring in the male condom, while there are 2 rings in the case of female condom. So this is your first ring, this is your second ring. The failure rate of female condom is higher when compared with the male. In the case of male condom, the failure rate is 2 to 14 per 100 women years, while in the case of female condom, it ranges from 5 to 21 per 100 women years. So coming to mechanism of action of condoms, these are the barrier method that physically prevent sperm from uniting with the eggs, as they do not allow the ejaculated semen to be deposited in the vagina. The high failure rate of condom is mostly due to the inappropriate use by the beneficiaries, and this is an MCQ question. Coming to the advantages of condom, so it is quite cheaper with no contraindication, and it is provided free of cost in the government family welfare program. It has no side effect, it is easy to carry, simple to use and disposable. It protects against the sexually transmitted disease like gonorrhea, chlamydia, HPV and HIV virus. It also protects against pelvic inflammatory diseases. It reduces the incidence of tubal infertility and ectopic pregnancy. It helps in the protection against the cervical cell abnormalities, and it is quite useful when the coital act is infrequent and irregular. Coming to the disadvantages or the drawback of condom, so it may accidentally break or slip off during coitus. So in that case, the female has to use some sort of emergency contraception. In some couples, it may also lead to the inadequate sexual pleasure. It has to be discarded after one coital act, and if the person is allergic to latex, he may develop some allergic reaction. So the only contraindication in the case of condom is that if the person is allergic to latex, then the person should not use condom. Otherwise, as such, there are no contraindication for the use of condoms. So many times examiner asks the non-contraceptive benefits of condoms. So these are very important. So first is it helps in the prevention of sexually transmitted diseases. Second is it can be used in the balloon tamponade to control postpartum hemorrhage. So in the case of atonic postpartum hemorrhage after the delivery, a tamponade is made with the help of a catheter and this condom, and it is being inserted in the uterus. So it is being filled with the warm saline. So it applies pressure in the uterus and helps to control the bleeding. In that way, it is used to control postpartum hemorrhage. So this is a transvaginal ultrasound probe, and for every new patient, this is being covered with the condom before inserting into the vaginal tract for doing the ultrasound. And in cases where female has anti-sperm antibodies, so as a part of treatment, the male partner is advised to use condom. Coming to diaphragm, it is a cervical barrier type of birth control. It is also known as a Dutch cap. So it is a dome-shaped device which is made up of synthetic rubber, and it is inserted into the vagina to cover the cervix, and it is often used with a spermicide. Coming to the mechanism of action, the spring creates a seal against the wall of the vagina, and it blocks the sperm from entering the female reproductive tract. It also helps in the protection against the inflammatory disease and human papillomavirus infection, and it must remain in the vagina for 6 to 8 hours after last ejaculation. In the case of female condom, it can be immediately removed after the sexual intercourse, but diaphragm is to be removed after 6 to 8 hours of last coital act. Its failure rate ranges from 6 to 12 per 100 women years. The drawbacks include the increased risk of urinary tract infection, yeast infection and bacterial vaginosis, and if left in situ for more than 24 hours, there is a risk of toxic shock syndrome. You can see in the diagram, it is a small cup-shaped device that often fits over the cervix, and it is used with the spermicide to increase its effectiveness. Then we have a vaginal sponge that comes under the trade name of Today. So sponge is a barrier method of contraception and it also combines a spermicide to prevent conception. It is saturated with 1000 mg of spermicide, that is non-oxynol 9, and it's a very important MCQ for examination. There are various disadvantages of sponge, that it can lead to toxic shock syndrome if it remains in situ for a longer duration of hours. It does not provide protection from the various sexually transmitted infection. There is increased risk of yeast infection and UTIs, and the failure rate varies in nullipara and Paris women. And in nullipara we have 9 to 20 per 100 women year, and in Paris women there is increased risk of failure and ranges from 20 to 40 per 100 women years. So chemical agents are also known as a vaginal chemical spermicide, and they are surface active agent which attach themselves to the spermatozoon and they inhibit the oxygen uptake and thereby they kill sperm. Coming to drawbacks of chemical agent, they have a high failure rate. They must be used immediately before the intercourse and they may cause burning or irritation in some individuals. So coming to the last part of the video, we'll do some MCQ related with the barrier method. So first is, barrier methods are all except the diaphragm, foam tablets, vaginal sponge or the Lippes loop. So the answer is Lippes loop. We have already read diaphragm, foam tablets, vaginal sponge. So Lippes loop is first generation intrauterine device. Today, a contraceptive contains prostaglandin, norethistérone, 9-non-oxynol or copper releasing mesh. So we have read the answer is 9-non-oxynol. Next question is, which of the following is a conventional contraceptive? So we have read these are the contraceptive which require action at the time of sexual intercourse. So the answer among them is condoms. So thank you for watching.